So let's start with the muscles of the back. So starting with the borders of the back, it is bordered superiorly by the superior knuckle line. In the lower area, it is bordered by the sacrum, coccyx and the iliac spine, and on the lateral side, it is bordered by the posterior axillary line. Moving to the classification, it can be classified in two ways, by location and by the origin. If we talk about the origin, muscles of back can be divided into the muscles having cranial origin and muscles having spinal origin. Means that the muscles arising from the cranial part, for example, the trapezius muscle comes into the first category, and in the second category, the muscles arising from the spinal part are its example. Moving ahead, by location, we can classify the muscles of the back by location also, like the superficial one, then the intermediate and the deepest, the deep one. Deep one are those muscles that are closest to the bones. Superficial, they are attached to the shoulder girdle. Intermediate, they are attached to the posterior thorax. And in the deep back muscles, they are attached to the vertebral column, that is a bone itself. So, moving ahead, superficial back muscles, these are the muscles that are attached to the bones of the upper limb. Here we can see examples of the superficial muscle, trapezius muscle, latissimus dorsi muscle. Then the intermediate muscle, here is the example, levator scapulae muscle, serratus posterior superior, rhomboidus, serratus posterior inferior, and in the deepest part, deep back layer, spinalis, longissimus, iliocostalis, spinalis thoracis, longissimus thoracis, iliocostalis, lumborum. These are its examples. So, in superficial back muscles, we are going to study about the trapezius muscle, latissimus dorsi muscle, levator scapulae, rhomboid major and rhomboid minor. So, here is our trapezius muscle. This picture or the diagram is depicting the trapezius muscle that originates from knuckle line, basically the medial 1/3 part of the knuckle line, external occipital protuberance, spinous process of C7, spinous process of T1 to T12 vertebrae, and the knuckle ligament. And it gets inserted into three parts, like it can be divided into three fibers: the upper fibers of trapezius muscle, middle fibers, and lower fibers. The upper fiber of trapezius muscle gets inserted into the lateral 1/3 part of the clavicle, and the medial fibers or the middle fibers can be and the middle fibers are inserted into the acromion process and spine of the scapula or the spinous process of scapula, and the lower fibers, these are inserted into the triangular area at the medial end of the spine. So the action of the trapezius muscle is to elevate, to retract, and abduction of the. So moving ahead about its action, it is used for elevation, shrugging, retraction, and abduction beyond the 90-degree rotation. The second muscle is the latissimus dorsi muscle. Latissimus dorsi muscle originates from the outer lip of the iliac crest, lumbar and sacral spine, inferior angle of scapula, and from the spinous process of T7 to T12 vertebrae, and also from the lower foreribs. And its insertion is the intertubercular sulcus or the bicipital groove that is present in the humerus here, or it can be seen here as well. So the action of latissimus dorsi muscle is to in abduction, extension, medial rotation of shoulder, as in swimming, climbing, and pulling, and it can also be referred to as the climbing muscle. Here we can see a depiction that is showing here the greater tubercle, lesser tubercle, and in between this is the floor or the floor of the intertubercular sulcus or the bicipital groove that is present over the humerus. In it there is a lateral lip and a medial lip, and we have a mnemonic that is known as the lady between two majors. It means here are the two majors. On the lateral lip, pectoralis major muscles get attached. On the medial lip, teres major gets attached, or it is the insertion point of these muscles. Though two major muscles gets attached over the hair, and in between there is the floor, that is this point, and also known as the bicipital groove, and here is the attachment point to the latissimus dorsi muscle. So, the third muscle is the levator scapulae muscle. Levator scapulae muscle originates from the transverse process of C7 and C2 vertebrae, posterior tubercle transverse process of the C3 and C4, and its insertion is on the superior angle and the upper part of the medial border of the scapula, and it helps in elevation of the scapula, and it also supports the scapula during the movement of the arm. We can see its insertion and its origin from here. Next muscle is the rhomboid minor muscle. It originates from the spinous process of T2 TT. Next muscle is the rhomboid minor muscle. Its original So next muscle is the rhomboid minor muscle. It originates from the spinous process of the T2 to T5 vertebra and spinous ligament, and inserts at the medial border below the root of the spine, and its action is the retraction of the scapula. So basically the rhomboid minor and the rhomboid major, both these muscles have same action, that is the retraction of the scapula. This was rhomboid minor, and here is the rhomboid major muscle, which originates from the lower part of the knuckle ligament and the spinous process of C7 and T1 vertebra, and its insertion is the root of the spine of scapula, and action is to perform the retraction of the scapula. Next is our intermediate muscle, that is the serratus posterior superior and serratus posterior inferior. First one is the serratus posterior superior. It gets originated from the spinous process of C6, C7, T1 and T2, and inserts at the back surface of the ribs 1 to 5, and its action is to elevate the ribs or to lift up the ribs. And basically it is present beneath the rhomboid major muscle, rhomboid muscles, and the serratus posterior inferior muscle. Its origin is from the spinous process of T11 to L2 vertebrae, and it gets inserted into the lower 4 ribs, and its action is to lower the ribs or to depress the ribs, and it is present in front of the latissimus dorsi muscle. Moving ahead, we have the deep muscles of the back. So deep muscles of the back are also divided into three parts: the superficial layer, intermediate layer, and the deep layer. So the deep muscles of the back, first of all the superficial layer, we have the splenius capitis muscle, originates from knuckle ligament and the spinous process of C3 to T2 vertebrae, and getting attached to the mastoid process that is present on the temporal bone, and its action or function is to rotate and incline the head and neck to the same side. Then we have the splenius cervicis muscle, that originates from the spinous process of T3 vertebrae to T6 vertebrae and the supraspinous ligament, and its insertion is seen on the posterior tubercle of transverse process of C1 to C3 vertebrae, and it produces action on the head and neck, which is the rotation of head and neck to the same side. Next one is the iliocostalis muscle. It gets originated from the sacrum, iliac crest, angles of all the ribs, inserts into the transverse process of C4 to C6 vertebrae and the ribs 1 to 12, and its action is the extension and lateral flexion of the vertebral column. Next, we are having the intermediate layer of the deep muscles of the back. First one is the longissimus cervicis. We can see its origin, insertion, and the function. Its function is to the lateral flexion of the neck. Longissimus thoracis muscle, its function is in the extension and lateral flexion of the spine, and it originates from the lower cervical and the old thoracic lumbar sacrum vertebrae and also the iliac crest, while its insertion is the ribs 2 to 12 and the transverse process of thoracic vertebrae and the lumbar accessory process. Next one is the longissimus capitis muscle. Longissimus capitis muscle also attaches to the mastoid process or inserted into the mastoid process of the temporal bone, while its origin is the articular process of C4 to C7 vertebrae and the transverse process of the T1 to T4 vertebrae, and helps in the extension and rotation of head to the same side. Next one is the spinalis cervicis and spinalis thoracis muscle. So spinalis cervicis muscle is seen to have action over the cervical spine. It helps in the lateral flexion and extension of the cervical spine, while this spinalis thoracis muscle, it is helpful in the lateral flexion and extension of the thoracic spine. Thoracis for the thoracic spine, and spina and cervicis for the cervical spine. These deep back muscles into several groups. First one is the spinotransversalis. In this, we have splenius capitis muscle and splenius cervicis muscle. Their action is to extend, rotate, and laterally flex the head and the neck. Then we have another group, that is the erector spinae muscles. In this we have iliocostalis muscle, longissimus muscle, and spinalis muscle. Its action is to extend and laterally flex vertebral column and the head. The third group is the transverso spinalis. In this we have the semi-spinalis, multifidus, and rotator muscle. These three set of muscles produce action over the stabilization, extension, and rotation of the vertebral column. And finally, we have the segmental muscles. In this group, we have the interspinalis muscle, intertransversary muscle, and the levator costarum. These segmental muscles produce action over the stabilization of the vertebra, assisting in the lateral flexion and the elevation of the ribs. So, these were the groups of the deep back muscles. I can show you. So now I can show you the diagrams related to these muscles. Levator costarum muscle, which is a part of the segmental muscle group. Then the intertransversary cervicis muscle, also a part of the segmental muscle group. Here is the lateral lumborum muscle, medial lumborum muscle, medial lumborum and the lateral lumborum muscle. We have this interspinalis muscle. Then the rotator group that comes under the transversospinalis muscle, rotator brevis and the rotator longi, that is responsible for the stabilization, extension and rotation of the vertebral column. Then we have the multifidus group that comes under the transversospinalis muscle. Here is the semispinalis capitis muscle, the semispinalis cervicis muscle. Here we have the semispinalis cervicis muscle. So here we can see the longissimus thoracis muscle, spinalis muscle, and this one is the longissimus capitis muscle. So these three are from the group of muscles erector spinae, and they are helpful in the extension and lateral flexion of the vertebral column and the head. Then we have this semispinalis thoracis muscle, which is a part of transversospinalis muscle, helpful in the stabilization, extension and rotation of the vertebral column. Then we have this iliocostalis muscle, iliocostalis cervicis, iliocostalis thoracis and iliocostalis lumborum. These three are also a part of the erector spinae muscle, which is helpful in the extension and lateral flexion of the vertebral column and the head. Then we have the longissimus cervicis muscle, semispinalis cervicis muscle, semispinalis capitis muscle. These three all muscles helpful in the stabilization, extension and rotation of the vertebral column. It was all about the muscles of the back. I hope you understood it well. Thank you.